Well, hey everyone, I'm Shirish and welcome back to my channel. Well, the aging population today requires a high demand for personalized care, as well as advances in the field that make this area more exciting than ever before. So we're going to talk about one such profession in high demand today, and it's nurse practitioner or registered nurse. In fact, this is the #1 rated career in medical industry, so listen closely. But before I begin this video, I know it could be really confusing on selecting the right career for yourself. And a lot of people, they actually struggle with it. But you don't have to, because I have created a super powerful guide for you based on my very special extraordinary career development model that can literally save you a ton of hours and most importantly will save you from a lot of stress. One guide you must have for your career development, and you can download this guide for free by clicking on the link in the description box. In this video, I will talk about 5 key points. What is nurse practitioner or registered nurse? What is the future scope and job opportunities in this career? What skills are required to be this nurse practitioner? Roles and responsibilities of a nurse practitioner, and complete roadmap on how to build your career in this particular field. So let's hit it up for nurse practitioner career. Hi, I'm Shirish Gupta, and I empower people to hack their success, rise above the challenges, and confidently create an extraordinary life they deserve. So let's start from the basics. Who and what is this nurse practitioner? The nurse practitioner is a type of mid-level healthcare provider that can assess patient needs, order and interpret diagnostic tests as well as prescribe medications. They have been trained to cover basic disease prevention along with providing health promotion techniques, but do not provide enough expertise for more complex conditions because they lack educational expertise for that level. Nurses are great at providing preventive care in addition of coordinating patients' treatments. However, they do not have an expert level knowledge about specific diseases or ailments, which limits their ability when it comes down to treating these types of emergencies quickly without delay. Nurse practitioners work closely together across disciplines such as nurses, doctors, or administrative staff, so everyone can be aware about what's going down at any given time. So, what is this field of nurse practitioner? Nurses have a lifelong dedication to the health and well-being of individuals, families, and communities. They work in many different settings with varying level prescription authority, but all share common foundations like compassion, knowledge, or the understanding which allows them to make sound decisions based on fact, not just theory. This means taking time during patient care activities such as assessment or education so that nurses can communicate more effectively by speaking from experience instead expertise alone. NPs are more than just pillars of the healthcare system. They are also its backbone. As providers who have committed their lives to helping other people live better, NPs bring a fresh perspective and educated advocacy that is essential for passing important legislation on behalf of patients everywhere. NPs lower healthcare costs by providing patients with high quality care and counseling. The job title may sound fancy, but behind every one of these stands an honest hard worker committed 100% towards making sure others get well. Now let's understand more about this career with the future scope, salary offered, top companies hiring for NPs. Well, just a word, if I say NP or RN, they're the similar thing, which is nurse practitioner or registered nurse. Well, with their advancement, clinic training and expertise, nurse practitioners are important because they have even more of an opportunity to make a difference in the patient's life. For all the reasons listed above, any shift a nurse practitioner works could see him or her potentially saving the lives of their patients. These are some of the reasons why nurse practitioners can be an important career for you as well. Now, some of these are job security and opportunity. Nurses have so many potential paths from which they can choose, and even better, they can change their path at any given time without worrying about jeopardizing their career. The increased demand for nurses will lead to an increase in their salaries as well. Another point is flexibility. People need medical care day and night, on weekends and weekdays, in urban and rural locations, and in all sorts of settings. Because medicine is such a broad-reaching field and nurse practitioners are so high in demand, nurses often have the luxury of choosing their schedule and location. But it really depends where you work. Some jobs are really very stressful. Next comes career and professional growth. Nurses always have to be on their toes, but that's what makes them so great. They're adaptable and able to take whatever comes at them with an open mind, which is amazing. Next is respected and trusted career for sure. Year after year, being an RN is among the top 2 most respected and most trusted professions, and for a good reason. Nurses are among the most respected professionals, and for good reason. In this tough job that requires compassion as well as skillful stamina, nurses enjoy great rewards, including admiration from their peers along with families everywhere they go. Now let's discuss future scope and why it is an important career field in years to come. With coming times, an increase in NPs or RNs demand is predicted, with the Bureau of Labor Statistics predicting that by 2028, a 26% increase in the field, and that to solely North America. This career has huge demand in almost every country in the world. Some of the major roles that you can get after NP are family nurse practitioner, acute care, anesthetics, pediatric nurse practitioner, emergency nurse practitioner, adult gerontology, psychiatric nurse practitioner, neonatal, women's health nurse practitioner, orthopedic, oncology nurse practitioner, and many more. Companies that offer jobs in these roles are definitely hospitals, urgent care centers, nursing homes, and any place that deal with healthcare, including all big and small hospitals. So it's really in high demand. When we talk about the average salary for NP role these days, job market is about $50,000 to $100,000 annually on the world scale. Generally, government agencies or private institutions offer salaries close to this number, though salaries can vary significantly across institutions and geographical regions. Other factors that impact salaries include experience level and education background, and for more experienced roles can go up to anything between 120 to 150,000 US dollars annually, which is really excellent. Now that we know there's a huge growth in NP or RN career, let's explore skills required and job responsibilities and ideal workday in this profession. Well, RNs need a versatile skill set to succeed in this dynamic work environment of hospitals, community health organizations, insurance companies, clinics, and other healthcare organizations. These core competencies include the following. First is definitely medical knowledge. Although NPs don't have to perform any surgeries, they play an important role in supporting a doctor during these complicated procedures. Yes, very important. An extensive knowledge of these procedures and some basic techniques will come in handy as well. The next comes management and administration. Like the name suggests, this would be the first skill trait for any manager. On any given day, NPs tackle multiple concurrent responsibilities, sometimes within short time frames, including pre-op or H&Ps, admission discharge paperwork, hospital rounding, post-operation follow-up, wound care, pain management, and patient education, to name a few. Next comes communication and interpersonal relations. Well, you need to have excellent listening skills and the ability to write clearly so that no one's confused or mistakenly anything. Not only do NPs have this responsibility within their own community, but also when talking with other people about topics like medicine, prices, or quality issues in our system. However, sometimes we need to speak out on behalf of patients if things get too far gone, which means having strong speaking abilities come into play, as well as because it will convince others why change need made quickly before damages can be irreversible. Next comes compassion. NPs work with people who are struggling from serious medical problems. Realizing the pain of a person and family can help them do their job well. Having compassion to one's circumstances will help you figure out a better healthcare route for the patients. You may need, in some cases, some technical skills as well for organizations who use regularly updated software for medical record as well. Well, now let's look into roles and responsibilities of a nurse practitioner. So it's about talking about what exactly registered nurse or NP do. NPs are healthcare providers that can prescribe medication, examine patients, order diagnostic tests, diagnostic illness, and provide treatment, much like physicians do. In fact, as reported by Kaiser Family Foundation KFF, it's estimated that NPs can provide 80 to 90% of care that primary care physicians offer. Yes. So broadly speaking, the nurse practitioner today is one who provides acute and primary care to people across the lifespan. Their experience as working nurses gives them a unique approach to patient care, while their advanced studies qualify them to take on additional duties that are usually left to physicians. Listening to patients, families, and communities to understand their health needs and offer emotional support, diagnostic and treating health conditions, creating patient care plans. In some cases, prescribing medications are some of the important roles as NPs or RNs. Along with this, educating individual and family on disease prevention, ordering, interpreting, and discussing results of diagnostic tests with patients and doctors. Nurse practitioners work independently and in collaboration with other healthcare professionals as well. In settings that include hospital, private policies, urgent care clinics, and other long-term facilities. Keep in mind that the scope of practice for a nurse practitioner varies from state to state and somewhere even from setting to setting. Now let's look into the most curious section on how to pursue this career with complete step-by-step roadmap for school students, college students, and professionals who wish to enhance their skills for better roles. Well, if you're in high school, becoming an NP or RN involves certain steps. Having a bachelor's degree comes first. In most countries around the world, you are allowed to take nursing degree education right after school. You would need a basic bachelor's in nursing actually. After that, you have to register yourself as a nurse to start practicing. The simplest route to becoming a nurse practitioner who already has their bachelor's degree is by earning a master's degree. Some nurses may choose to skip this step and go right into enrolling into a graduate program, while others choose to get a few years of experience before continuing their education. In most countries, nursing requires a license that can be procured after graduation or after post-graduation study. You can work with a nurse recruiter or check out nursing job boards to help find right starting position for you. If you're already pursuing your undergraduate degree in related field of nursing or medical, you can absolutely take up master's degree in nursing. In summary, to become an NP, one must be a registered nurse, RN, hold a bachelor's of science in nursing, complete an NP-focused graduate master's or doctoral nursing program, and successfully pass a national NP board certification examination. Nurse practitioner, as I said before, is a specialized degree, so it is mostly offered as a bachelor's or a master's degree, and in some cases with specialization courses as well. Given that it is one of the most popular fields at this time and in the future to come, a lot of universities are offering a lot of programs that can educate you to be nursing practice. Some such universities that are world-class programs are Yale University, Duke University, Columbia, Johns Hopkins, University of Virginia, University of Edinburgh, King's College, University of Manchester, NUS, AIMS, AMFC, and a lot of other universities also. For professionals, becoming an NP from scratch can be difficult because it requires a good decade of your time to complete your medical education. If you don't have a nursing degree, you can't pursue this field, so probably get a nursing degree. It's the only way for you to get into this profession. In the end, if you are a compassionate person, have interest in medicine and helping patients, have done a lot of volunteer work in medical field, then success as an NP should come easily to you. And this could be a right career for you. Well, thank you so much for watching this video. Really appreciate it. Please make sure to support my work by liking and sharing this video, and also subscribe to my channel and hit that bell icon. I will see you shortly with another amazing video on career, college admission, and coming very soon, living extraordinary. I'll see you soon. Bye-bye.